Ivy
11.
Armstrong. We have orders for Ivy Armstrong today. We're going to be doing an exploratory abdominal laparoscopy, and through her peripheral IV, we're going to be delivering 1,000 milliliters of normal saline over the period of 4 hours. So that'd be 250 mLs per hour. And we're also going to insert a saline pump NG tube, which will go through her into her stomach, and we will suction intermittently to check her gastric juices. And because we're going to be withdrawing liquids, we're going to be giving her the normal saline to make sure that she doesn't get too dehydrated. So before I head in, I'm going to look at my medication. We've got the normal saline. Bag looks intact, not expired. It's for Ivy Armstrong, delivered through IV for her dehydration, and that's going to be delivered as soon as I walk in, and will also be documented. All right, I'm going to do hand hygiene, and we are going in. Knock, knock, knock. Hello, Ivy. How are you
Hello.
doing today?
I'm good. How are you?
I'm good. My name is Connor, and I will be your nurse today.
Okay.
So we just have a couple of things to get through today, but it shouldn't be too hard.
Okay.
Do you mind if I set this at the edge of your
No, not at all.
bed? Okay. Alrighty, so we are going to be giving you an NG tube, which is something that is kind of uncomfortable. Goes through your nose, into the back of your nasal cavity, down through your esophagus, and into your stomach.
Oh, wow.
It's not the best, but they tell me I'm pretty good at it, so
Wow.
shouldn't
That's
be
good.
too uncomfortable. And because we're going to be suctioning stuff, some of those juices out of your stomach to check and see why you're in so much pain.
Is that why I was feeling a bit depressed?
Something's wrong down there in your stomach, so we're gonna do that NG tube to make sure there's no obstruction and go through that. And we're also gonna hang some normal saline, which is gonna be delivered through your IV here, and that's just to make sure that you're hydrated.
Okay.
So can you give me your name and date of birth?
Ivy Armstrong,
And what's your birthday?
March 9th, 1964.
Okay. And do you have any allergies, Ivy?
No, a latex.
Latex? No.
Yeah.
And you're doing okay other than the stomach pains?
Yeah, I'm okay.
Okay. All right. Well, hopefully this will help you. So I'm going to, I already propped you up. I'm going to sit you up just a little bit here. So we're going to get that NG tube in first. Have you ever had an NG tube?
No.
No?
This is the first time
So I will guide
I'm
you
hearing
through
about it.
I will guide you through it. Let me get some gloves on.
Okay.
So I'm just going to basically get this thing down into your stomach. I know it sounds kind of crazy. And hygiene. Gotta be safe here, Ivy. Alright. Before I do any of that stuff, I'm just gonna have to do a few little examinations on you to make sure that you're okay and ready to do the procedure.
Okay.
So I'm just gonna look up your nose to make sure that there's no obstruction, no redness, swelling. I need to grab a tissue. 1 second, Ivy. Sorry about that. Here's a tissue. I just wanted you to blow your nose and clear out any obstruction. Okay, good.
Sorry, wrong packaging. That was for your NG.
Grab my trash can.
Okay.
Alrighty. One more thing I'm gonna do is kind of decide which nostril we're gonna use. So, would you mind blowing out of your left nostril? Now you're right. I think the right one sounded a little bit clearer. Is that okay if I work at that side?
Yeah, that's okay.
The right one's cool? Okay. Awesome, awesome. I'm also going to have to look into your mouth to make sure that there's nothing serious going on in there. No redness, no wounds, nothing. The teeth look good. Have you ever had a history with deviated septum? Have you broken your nose? Anything like that?
No,
No?
no.
Sometimes it can be tough to do these when people have past trauma to their nose, so I just wanted to ask. All right, so I'm gonna get all of my stuff nice and ready. Where is the... There it is. Got my tape, got that. Okay, and we are going to leave that sitting right here. And we just have to do one more examination for your mouth. We gotta check your gag reflex, okay? If you could open up. Oh, okay. Good, good, good. That's always a good sign. And lastly, I am going to need to auscultate your stomach here to make sure that nothing's, if I can hear anything through your bowels. Do you mind if you lift your shirt up? Thank you, Miss Ivy. All right, so we start on the right. Upper right. Oh yeah, this goes, so this is the pathway of your colon, so that's why we do it like this. Pretty faint, so we're gonna go ahead and start and get you feeling better, okay? Alrighty. So firstly, I'm going to measure this tube to make sure that I know how much to put in you, okay? Did you hold that there, Ivy? Yeah. Alright, so down to xiphoid. It's right around 55. So give me 1 second and I'm gonna tape this. Let me get my tape ready. I'm sorry, Abby. This would still be in the bag, so I would have done the tape first and then done that and been ready, but there was no bag, so I need 3 pieces of tape for you, Miss Ivy. 1 for your nose, 1 for your cheek, and then 1 for your gown. It'd be tricky though, one of the cheek though, just split it. There we go. Alright, we are going to make some moves here, Ivy. Are you ready to get started? Okay. I just need... Oh, I got it. I couldn't find this. And I'm gonna give you this glass of water here, okay?
Yep.
So we're gonna start and you're gonna tilt your head back. I'm gonna insert the tube and here you go, you can hold that. And then I'm gonna help you get this down to the bottom. If you feel anything at all that doesn't feel right, just put your arm up and I'll stop.
Okay.
So just let me know if there's anything that you feel like goes wrong, okay?
Okay.
Okay, so tilt your head back and we're gonna insert, okay? Got it there? Okay. All right, so we're gonna go forward here and just remember to put your arm up if anything goes wrong, okay? Whenever you swallow, I'm gonna proceed it further, okay? So go ahead and take some sips. Good job. Great job, Ivy. So that we got that to the 55. That is perfect. How you feeling?
I feel God.
The beginning's the worst, huh? Right when you get it in there, that's the worst part. So I'm gonna get this positioned up here for you. Okay. I know it's not the most comfortable, but are we feeling better than when I first stuck it in there? Alrighty. Yeah, usually they have special tape for this, Ivy, but I think they ran out. There we go. Okay, there we go. That's gonna stay there. Alrighty, and next thing we're gonna do is just suction out some of that gastric juice so we can test it. We're gonna test the pH of it, okay?
What's the pH?
So we want to make sure that your pH is acidic because it should be, you know, considering it's your stomach acid and everything. Boom. You feeling any pain?
No.
No? Okay.
I feel
I'll try and get
feel
this over
something
with.
in my stomach.
Okay. I messed up and should have sent her to X-ray.
No, you haven't.
So send her to X-ray.
You
then-
told me you can. After this, I can go to the X-ray.
Okay, after this you can. Okay. It's fine. Well, I would have told her to go to the X-ray after I got that in to make sure that's in her stomach. So go to X-ray, and then I come back. Okay, X-ray looks good. Okay, cool. Make sure everything's good, and then I would have done the juice. So boom, and I test this. Make sure that your stomach acid is acidic, because if not, that would not be good. And we're looking for anything below 4 below. That's a 3. Good, good, good. Okay, that looks good. Next, we are going to set you up to the suction machine, and we're going to intermittently suction at a low rate, which is gonna just kind of give us updates and get that stuff out of your stomach, because we think that's what's wrong, is the acid in your stomach is kind of making you feel a little upset. So we're gonna get that out, and we're also gonna replace it with these fluids. So I'm gonna turn this on, intermittent, low. Okay, sounds good. You feeling okay still?
Mm-hmm.
Alrighty. So here I have our lactated ringers for you, Miss Ivy, which is going to help with hydration.
Mm-hmm. Normal saline.
Yep, it's normal saline. It's not expired, and we're going to do this through your IV.
I've had a lot of those. I even now know the names.
Oh yeah, I know, right?
Mm-hmm.
No holes in it, as you can see.
Mm-hmm.
I'm going to be giving through IV for hydration. That's our second med check there. First, I forgot that we don't have. I'm going to just spike this guy.
So the rate is 1,000 milliliters over 4 hours, so 250 milliliters per hour.
Medication is spiked. My clamp is closed.
The time is right now,
Hang this.
and I'll document after.
Make sure my clamp's still closed. Righty. Clamp closed here. So I'm gonna get this into the machine here. all set up. Let me make sure that there's nothing in here. Okay, we are good. You feeling okay, Ivy?
I'm good.
Okay. So, final med check is our lactated ringers for Miss Ivy for hydration purposes because we are going to be suctioning the liquid and fluids out of her stomach, so that will cause some dehydration. So we just want to make sure that we keep her fluid levels pretty stable. We're going to be doing this through IV right now, and it'll be documented.
We're waiting.
So I'm going to shut this guy. Got that all set up. Got my 3 med checks in. I'm doing another one just for fun.
30 degrees, so that way.
Alrighty, Ivy. Have you ever had a IV pump set up like this?
Yeah, many times.
Yeah.
Check on you.
Alrighty. I'm going to go ahead and prime this real quick. Just to make sure that there's some liquid going through it. Okay, that's primed.
I know.
Put this back on here. So I'll put the cap on here, that's primed, boom. And then I have my alcohol wipe. Alcohol wipe. I'm gonna wipe that for 30 seconds. 30. Oh, sorry, Abby. And then I've got this, which gonna flush it with some saline here. IV site looks not red, not swollen, and gonna make sure that as I flush this through that it remains so. I'm gonna aspirate a little bit. How's that feel? Feeling okay? Does that feel okay, Ivy?
Yeah,
Ivy, does that feel okay?
it feels okay.
Okay. No redness, no swelling, so we are going to be good to go here. Good catch. Oopsies. I messed up. Leave that there. I need to clean this one more time.
I literally was like,
Let's go over O2 real quick so you can just have a quick little break.
I need to go get a wipe.
Press channel off and scroll down. I know, I was trying to help you about the restart.
no, I was like, why? I didn't know you had to do that, and I didn't. Okay, yeah, there's just some things. I think I did it down. That was actually.
I'll get in there. There we go. Sorry, Miss Ivy. My
Take your
My
time.
other nurse, yeah, Steven, my nurse I work with, he said he was going to get me these wipes, but
Oh,
we love him. It's okay. So I'm going to wipe this for another 30 seconds to make sure that that site's clean, just like I did with the sterile, with the normal saline.
Damn.
Get this connected. Jumbled up here. Duck down. Sorry, Abby. Whoa. New patient. Yes. Are you an adult, Ivy? Yes, you are. Normal saline. 250 milliliters
What these are, but they've been approved.
per hour, and we have a total of 1,000 milliliters, so that'll be time over 4 hours. We've got the lactated ringers, normal saline for hydration for IV. It's going to go through her IV pump, and that's going to be given now, and it'll be documented after we are done. So I'm going to go ahead and start this, okay, Ivy?
Okay.
And I just need to make sure that the line is clear.
I set it up.
Line's clear. How you feeling, Ivy?
It's good.
Good?
Mm-hmm.
Okay. Alrighty. You just let me know if anything else goes wrong.
Okay.
If you feel anything.
Probably why I was making weird noises. This wasn't. What time do we leave here by? 4?
Sure why this is doing this. Oh, I see. There we go. There we go. Sorry, the thing can be a beepy.
If worse comes to worse and you need to
Oh, it's because the other side's open. I see, Abby.
I honestly
Sorry
just
about
need
that.
to do IV.
Okay. Alright. So just let me know if there's anything else I can do for you, Miss Ivy.
Okay.
Are you feeling okay still?
I'm feeling okay.
Okay.
And talk my way through it.
I hope that is going to make you feel a little bit better. Get that
I meant like I'm just gonna talk my way through.
stomach acid out.
Okay.
Okay, I would
Seems
open
that
it,
was,
I would
um,
plant whispers.
That is what was causing the distress and stuff. Sorry about that. Got the trash can stuff.
It was just like, could I swear it's like.
Let's feel good on your pen. I got that. This is going.
And I'm like, this is what's gonna happen in this transition. And that's another thing, if I don't run through it, then I'm not gonna.
You got your call light there if you need to call me.
Okay.
I think it really
Hand
started
hygiene.
when I realized I was opening up the wrong package. And I'm like, alright, you can leave the packaging down.
Make sure I get all my stuff. Make sure to call me if you need that.
Okay, thank you.